So now we're going to take a look at the scans that we did of your oil glands in your eyelids. When you came in today, you said that you were experiencing a lot of discomfort, itchy eyes, gritty, that sandy, that burning sensation that you're getting towards the end of day. I can definitely see why you're experiencing that. As we look at your scans here, we see that your oil glands don't look quite normal. This is what your glands should look like. And we can see here that you have lost some of your glands, and that tells me that the oils in there are not functioning properly. They're not squeezing out onto the surface of your eye. So in order to get rid of some of those symptoms that you're having, we have some solutions here, or some treatments that we can do at home. We've partnered with Peeq Pro to help deliver this to you. And I'm gonna mark on this card, we have a foaming eyelid cleanser, which helps clean bacteria, plaque-like substance off the edge of your eyelid so your glands can function better. I also have the Peeq Weva cleansing system, and that helps you to utilize that foam cleanser better. It's kind of like using an electric toothbrush when you clean your teeth. This electric device or this vibrating device helps clean better. And then I also have for you some eye drops that are oil-based, and I know that you have an oil deficiency. So replacing with an eye drop that has oil in it will work better for you than some of those other over-the-counter products. So we'll start you on these things. I want to see you back in about 2 months. We'll see how you're doing. If your oils aren't starting to secrete better, we have more therapies that we can add, and we can talk more about that at that time. Okay, Rebecca, so I think we've got a good game plan. We've got the foam cleanser, the hypochlorous acid, that Peeq Pro Weva cleansing system that we've got for you. We're gonna be doing the omega-3 fish oils, and we're also gonna be doing those oil-based eye drops that we talked about for symptom relief. And then I'll wanna see you back in 2 months. Let me grab one of my staff members here. Tom, are you available for room 4, please? Okay, and then I will have, let me write down on here that 2-month follow-up. I'm gonna let you take up this with you and give it to the staff member when you're checking out today, and they'll go over all of those with you. And if you have any questions, you can please let them know. They're very, very well oriented with this stuff. A lot of them use the products themselves, so they can talk to you a little bit more about kind of what their experience is as well.
Rebecca, I'm excited to get you started on the Dry Eye Essential Box. I use a lot of the products in here. Doc has specifically curated some really good products. What we love about it is, one, it's really helped me with my dry eye. It's given me both short-term relief with the drops, but it also has warm compress, sponges, and then the tea tree oil is great. But the other thing that we really like about it is when we went out to price shop, we were really delighted by the Peeq protocol, because Peeq system is about 10% less than Amazon. So if you were going out to buy these same products on Amazon, you would find this to be less expensive if you were buying each of them individually. What can be confusing is sometimes when we have patients come in, they will say, but I can get drops cheaper. And that's true, you can, but they're not the right type of drops that are putting the oil-based drop in your eye for dry eye. Instead, they're a saline drop that's really treating something else. So make sure, if you do go out to buy this separately, that you're looking at the same apples to apples comparison. We have been using it in the office for a couple months now, and the staff and I use it almost every day. We love it. I want to show you how it works though, because sometimes it can be confusing for patients when they first take it out of the box. So this is the Weva device, and the Weva device is handheld, as you can see. You're going to insert the sponge into this channel here, and the sponges are dehydrated, biodegradable sponges. You're going to pinch it. When you put water over it, this will swell up and lock into place. Once it's locked in, you're going to essentially turn it on. So power button, you can change the vibration speed, and you're going to use it to slowly go over your lid margin and your lash line. In doing that, you'll be able to do a better job of cleaning your lids. We recommend that you use the tea tree oil cleanser. You can also use the hypochlorous that Doc has recommended. That's a really good question. Surprisingly, most of our patients are now calling us about discomfort, not blurry vision. and discomfort overwhelmingly is caused by an ocular surface disease like dry eye or blepharitis. Essentially, the world has changed a little bit where we're looking at screens more. That means we blink less frequently. In addition, we're seeing people who have come in who have had LASIK, have used Accutane at some point, or something else that's medical related, and those tend to dry out eyes. So while you may not have heard of it, it's actually becoming a really big issue, and we're trying to start treating it earlier so that you don't have bigger issues as you age. That's not uncommon. Actually, a lot of our patients say that when they get to this stage, that they're looking at us saying, my eyes don't hurt, they aren't dry. What we're seeing and what you came in for was irritation, redness, and grittiness. Those are the sorts of things that dry eye actually are creating. And so doc is trying to get you started on something that will help alleviate both symptoms and help prevent them in the future.
Okay, I understand that you do have some products that you're using to wash your eyelids with, but my job is to make sure that you're using the correct products to wash your eyelids with, and not all things are safe for the lids. You know, there's a lot of stuff out there that you might see on TikTok or on social media, but it's not always good and safe for the eyelids. So we have specifically researched what is the best stuff to be using around your eyelids. So I want to make sure you're using stuff that doesn't actually long-term make the problem worse rather than make it better. So that's why we've got all of the Peeq protocol put together for you.
Yeah, I understand. It's hard sometimes when you're not expecting that there's something in the exam that's gonna pop up. But when you called, you said that your eyes really hurt. One of the things we're really trying to do is help you with that discomfort. Better eyelid hygiene is the best way to help with that discomfort.
When I have a patient that has an ocular surface disease, it's important that I discuss their symptoms and how that relates to their diagnosis. But it's also important that I tie the diagnosis to their treatment. So in the case of Peeq, I will often say something similar to, we are concerned about your dry eye, but we can treat it. We've recently started using a new dry eye protocol from Peeq Pro. The Wave Eyelid Cleansing System combines a device, cleanser, and other therapies, and we would like you to get started on that protocol today. After I have diagnosed a patient, I use this simple ocular surface assessment card. I check the boxes of appropriate treatments, and most of our patients end up buying either the dry eye box or a Wave box. I hand the card to the patient. I ask them to take the card to check out with them and make sure that they receive the correct dry eye treatment from the staff. In my office, we also have the affiliate program on display. We have found it extremely easy and useful to get certain patients onboarded to Peeq. Plus, it's free to get started. The affiliate program is a way for offices to work with Peeq Pro without spending a ton of money to get started. It allows offices to sign up for Peeq without holding inventory. You still receive a generous royalty on sales, and you can still sell a variety of products that you recommend. We have also built in a variety of boxes for common challenges such as dry eye or Ortho-K. You can offer this full suite of products and services to your patients via the online portal.